The new drugs are rivaroxaban is one, so these are the generic names. Apixaban and endoxaban are those that are on the market at the present time. There are now, one of the big criticisms to these drugs were that there were no antidotes. That means if you would have a patient who would be bleeding, there's not very much you would have to do. You would give them plasma, try to replace whatever is not working, but that takes a while. And for one of the drugs, which is dabigatran, there is in different countries, there is now an antidote on the market. And for the other drugs, there is an antidote that has been published, the tests are done, but it's not yet commercially available. So this reluctance to use the new drugs was one, there is no clear prospective study done with the standard treatment, with what is now the standard treatment in cancer patients, but the cancer patients were taken out of groups of general patients previously. And the second was that there was no antidote in case of problems. The big advantage of the new drugs is that you don't have to test after you have started the treatment. The patient does not have to have blood tests done, which is the case with anti-vitamin K, where you very regularly do blood tests, sometimes very often. So that's one advantage. It's only oral, so it's only pills, so there's no injections. And some of the drugs, it's only one a day. Some of the others are 2 a day for the treatment. And there are interferences which are very frequent with anti-vitamin K, where depending what you eat, that can interfere with the drug, and then you get a different result in your lab tests. The interference with drugs is also present in the new drugs, but much, much less than in the previous treatments.